Meet Mark and Freya. They have been trying to conceive for a while without success. Let's check in with them.
Why are you not pregnant yet?
Well, even when we time intercourse correctly, there is only a 15 to 30% chance of getting pregnant.
What if we have sex every day or every other day? Does that help?
Only sex during the fertile window is helpful. More specifically, the 2 days preceding ovulation.
Ovulation? Why are you speaking in tongues?
Ovulation is the process in which a woman releases an egg. Hopefully, sperm is already waiting there to fertilize that egg.
Okay, so when are you ovulating next?
It is hard to pinpoint ovulation exactly. Every cycle, I track a few things, like my cervical mucus, my temperature when I wake up, and when I think ovulation is close, I start peeing on a test called Ovulation Predictor Kit, or OPK, to try to get an idea when ovulation is happening.
Okay, so let's say you get a positive OPK. Does that mean you ovulated that night? That week? How do you know these things?
So we cannot pinpoint exactly when ovulation happens. Once I get a positive OPK, ovulation happens 12 to 48 hours after it.
And how do we even know if you are actually ovulating?
That is when my temperature comes in. I measure my temperature every day at the same time, before I get out of bed. That is my basal body temperature. After ovulation, the body starts releasing a hormone called progesterone, which makes my body warmer. If I see my temperature rising after a positive OPK, that means I ovulated.
What if you don't get a positive OPK, but get a rising temperature?
In that case, two things could have happened. I may have missed my positive OPK test. For some people, the hormone surge that causes ovulation comes and goes really quickly. They might miss it if they don't test frequently enough. Another reason is I could be sick, or could have had a poor night's sleep. That is why I cannot make any decisions based on a single day temperature. I need to look at trends.
So what you are telling me is that this temperature thing is basically useless, then?
Well, it is useless for timing intercourse, but it is useful to confirm that I am ovulating.
Alright, I think I understand. So let's say you get a positive OPK today, we have sex, and you officially ovulate tomorrow. Then when do we find out if you are pregnant?
Great question. A home pregnancy test can give me a reliable answer about 12 days post-ovulation. If I am feeling anxious, sometimes I start testing early, but getting a negative test at, let's say, 10 days post-ovulation doesn't mean I am definitely not pregnant.
12 days? Why so long?
Once fertilization happens, the now joined cells start dividing into something called a blastocyst. That blastocyst will travel into the uterus and attach to the uterus wall. Once that happens, the body starts producing the pregnancy hormone beta-HCG. At first, it is a very small amount, so maybe a blood test can catch it, but not a pee test. Once there is more of the hormone circulating in the body, it becomes detectable with our at-home pregnancy test. This implantation usually happens between 8 to 10 days after ovulation, and it takes a couple of days for that hormone to build up in the body enough for the test to detect it. That is why we say a sensitive pregnancy test will be definitive at 12 days post-ovulation. For less sensitive tests, you have to wait until at least 14 days post-ovulation for a definitive result.
I have one more question about timing sex. Why can't we have sex anytime and get a baby? Why only on the 2 days prior to ovulation?
In short, sperm cannot live very long once it is outside of your body. Sperm can live for up to 5 days in cervical mucus, but even that is unlikely. 1 to 2 days prior to ovulation is best, as it is very likely that the majority of sperm can live for that long.
And does sex on the day of ovulation work too?
Yes, it does, but it is not as good for our odds of getting pregnant. Once the egg is released, it has a super short lifespan if it is not fertilized. So ideally, we want the sperm to be waiting for the egg, not the other way around.
Just like I am always waiting for you to get ready to go out for dinner. And do you release another egg later, or is it just the one?
Ovulation happens only once per cycle, although I could physically release more than one egg per cycle. In fact, that is somewhat common with certain fertility treatments. We will discuss that later.
So what you are telling me is that we really only need to have sex once or twice per cycle to conceive.
Yes, in fact, only one well-timed intercourse is enough to get me pregnant. But remember, even if we have perfect working bodies, we would only have 15 to 30% chance per cycle of conceiving.
Understood. I was hoping to go on a fishing trip with the boys next month. Do you know when your next fertile window will be? I don't want to miss it.
I can give you an estimate. I usually ovulate around cycle days 15 through 20. So that would translate to June 5th through 10th. Can you book your trip around that?
That is a 5-day range. Why can't you pinpoint it more for me?
The cycle stage before ovulation is called the follicular phase, and it varies a lot. In fact, even though I usually ovulate between 15 and 20, I once ovulated on cycle day 28.
Why so late?
Every cycle follicles start maturing. Eventually, one becomes more mature than the others. This dominant follicle starts producing a lot of estrogen that gives me fertile cervical mucus, and eventually they give me a luteinizing hormone surge, which causes ovulation. At that point, that follicle comes out of the ovary as a shiny new egg, ready to be fertilized.
Fertile cervical mucus? That sounds kinda gross.
It is not mucus like snot. Fertile mucus can be watery or have an egg-white texture, and it is a very cozy environment for your sperm to swim in and wait for the egg.
Sperm has it good. I wish I had a hot tub to wait for you while you were getting ready.
Well, you could. But we actually need you to avoid everything that is too hot. No saunas, hot tubs, heated seats, nada. That will affect your sperm quantity and quality. And we want as much healthy sperm as possible.
Alright, so I won't go in the hot tub when you are ovulating. Can we go to Lowe's and buy me a hot tub now?
No. You are not allowed to be in a hot tub ever until we conceive. Sperm, as well as the egg, takes a total of 3 months to produce. So anything from heat to sickness in those 3 months can be detrimental.
Yikes!
Which reminds me, we are also throwing out your tidy whities. From now on, you will need to let things hang. If you know what I mean.
Okay,
Alright, so going back to the cycles. I mentioned the follicular phase varies a lot. But you know what doesn't change much?
what?
The luteal phase.
There you go, speaking in tongues again.
So the luteal phase is the one after ovulation, with progesterone, where I am feeling warmer.
Oh, yes, I remember that.
So that follicle that was growing up in the ovary had a shell. That shell stays in the ovary and produces progesterone while the egg goes for a stroll in the fallopian tube looking for your sperm.
And those days are always the same?
Yes, they are usually the same, give or take a day. So once I ovulate, we know exactly how long my period, aka cycle day 1, is going to take to arrive.
That sounds like a good time to book my fishing trip.
Good idea. Wait for my ovulation, then you can book a trip for some of the 22 days after it.
Why 22?
Well, my luteal phase is 12 days long, and it is very unlikely that I will be fertile from cycles day 1 through 10 since I ovulate on cycle day 15 at the earliest. Sprinkle some math, and it sounds like the 22 days post-ovulation is safe, not fertile territory.
Gotcha! I will book my fishing trip based on your ovulation date.
So they went home and tried and tried. After many more months, they still hadn't conceived. They went to a fertility clinic and saw a reproductive endocrinologist, who recommended they try intrauterine insemination, or IUI. Let's check back in with them.
Alright, according to the doctor, our next step is to go in for a monitored cycle and IUI.
What does that mean?
Once I get my period, I will email the clinic to let them know. They will call me in throughout my cycle and perform an ultrasound. That is casually called a twanding because it is done with a wand that is inserted in the vagina.
Tua. Wandying. Oh, I get it.
Yes, so every time I go there, they check to see how my follicles are developing. I have been instructed to take letrozole, a medication, on specific cycle days as well.
And what does that do?
In short, letrozole will supercharge my ovulation, causing more follicles to mature. Every time I go in for an ultrasound, they will see how many follicles I have and what their size is. Once a follicle is big enough, I will use a trigger shot that will cause me to ovulate within a certain time frame. The nurse will tell us exactly when to come to the clinic, but the general rule of thumb is that we would be at the clinic with a fresh sperm sample roughly 24 hours after I take my trigger shot.
Why are we supercharging your ovulation?
Having more than one egg available to be fertilized increases our odds. We can go over this table when we have more time. At the same time, this supercharging also increases the chances we are going to have multiples.
Really, what are our chances of multiples?
This chart shows you the chances based on number of mature, aka big enough, follicles at the time of triggering. If I have too many, we may have to cancel the IUI. Otherwise, we may become the new octoparents.
We definitely cannot afford that. Alright, so let's say you have 2 good follicles. You trigger and we go to the clinic at the scheduled time with fresh sperm. Then what?
Then they do a procedure of washing your sperm.
What? Is my sperm dirty?
No. Your sperm comes with some extra stuff that needs to be removed before insemination. In a regular cycle with intercourse, that extra stuff would be automatically filtered by the cervix, but since we are doing IUI, that extra stuff needs to be removed.
You keep saying IUI. What is that?
IUI stands for intrauterine insemination. Once the sperm is washed, the doctor will put that clean, beautiful sperm into a little container, insert that container directly into my uterus, and release the sperm.
And what is the point of that? Why not just have sex instead?
Some people can do monitored cycles with timed intercourse, where everything is the same except they have sex instead of going in the clinic to have this artificial insemination. In our case, the doctor thinks it is better if we have this insemination.
Okay, but why won't the doctor just splash some sperm in your vagina? Why does it have to go all the way into the uterus?
Well, sperm is very teeny tiny. By putting it directly into the uterus, we reduce the distance in which they have to swim, and we increase the number of sperm available to meet and fertilize the egg.
Why do you even need a full load of sperm in there? Isn't just one good enough?
It would be, if we were doing IVF with ICSI. But that is only in the future, if IUI doesn't work for us. For now, I want you to know that the saying that you only need one sperm is not necessarily true. In fact, you need a large number of sperm to wear down the protective barrier the egg has around it, and then the egg still gets to choose which sperm to allow in and fertilize it.
Geez, like egg, like woman, you also gave me a run for your heart when we first met.
Ha, ha.
Alright, so can we have sex on the day of your trigger and then do the IUI the next day? That will really increase our chances, won't it?
Well, not really. Most clinics will ask us to abstain from sex for 2 to 5 days to make sure we have a fresh sample with a high sperm count and motility, aka a lot of good swimmers.
And what if it has been more than 5 days?
The absence of ejaculation, regardless if it is from sex or masturbation, should not be more than 5 days or fewer than 2 days before the IUI. Both affect count and motility. Having too little ejaculation can cause your numbers to get low, and we don't want that.
This is complicated, but I think I am getting it. What else can I do?
As the sperm-producing partner, you can take vitamins and supplements, eat and rest well, and do exercise. And as we discussed, keep those boys cool.
And as your husband?
As my husband, I would really appreciate if you comforted me and checked in to see how I am doing. Sometimes I get really anxious and sad about each failed cycle. Maybe we need to agree on something nice and fun we can do for ourselves to soften the blow of a cycle day 1.
Oh, I think I know the perfect thing we can do to soften the blow, scheming.
Oh? What is it?
A fishing trip.